Therefore it says, wake up, sleeper. Get up from the dead. Christ will shine on you. So be careful to live your life wisely, not foolishly. Take advantage of every opportunity because these are evil times. Because of this, don't be ignorant, but understand the Lord's will. Saints of God, my eyes have seen the glory and the coming of the Lord. He's trampling out the vintage with the grapes of wrath of storm. He hath loosed the faithful lightning of his terrible swift sword. His truth is marching on. I see him in the watchfires of 100 circling camps. They have builded him an altar in the evening dew and damps. I can read his righteous sentence by the dim and flaring lamp. His day is marching on. Hello, welcome to Conversation with Faith Leaders. My name is Brandon A.J. Davis, founder of Content Writing Service and Conversation with Faith Leaders. And I'm delighted to be with you yet again to have another conversation. And today I get to have a conversation with a good friend of mine, and we have a storied history. We were some smart people in school. We were some very intelligent young people in school. In fact, let me just show you how great and intelligent we look. Katrice, don't feel bad.
Oh, wow.
We have changed.
Oh, no. We did not discuss this.
This was us in college. This was us in college in Orlando, Florida, at the Hilton World Resort. We were students attending the Honda Campus All-Star Challenge, which was an academic bowl sponsored by Honda Corporations of America. So this was us in college. We were some young, smart-looking kids. Weren't we?
Yeah, absolutely. We were on the quiz bowl, right, in college, right. Absolutely.
So
we were nerds then. Back then, we were nerds. We were, the smartest of the smart at a nerd, at a quiz bowl meeting, which I loved. It was, for me, the best time in college. It was one of my favorite things about being at Spelman. Like, I loved being right in a tournament like that, and meeting you was wonderful, right? It was eye-opening. The whole experience was just so wonderful. So, like, what they do for students, so fun, right? Like, yeah.
And for those of you who don't know about it, Honda Campus All-Stars is sponsored by Honda Corporations of America. They paid for everything. I mean, they paid for suits, they paid for tickets, they paid for the hotel, matching T-shirts and polos.
Yeah. Right.
All you had to do was show up. Needless to say, my team didn't do that well. We did the best that we could, but it's kind of hard to compete against Spelman women, But hey, we hung in there with the best of them.
I hear you. That was a surprise for us when we went down there. We did so much better than we thought we would. It was just a great time. We didn't win. Actually, Morehouse ended up winning because our brother's school. But it was all of those kids, these, even now they're doing great, like brilliant kids at Black schools. It was just really, really a time.
And it was amazing for me because, you live in the world you live in, and to see 64 different HBCUs I was like, I didn't know we had that many black colleges and universities around the country.
Yeah.
And you met so many different people. It was amazing.
Mm-hmm.
I went back to back, 05, 06, if I'm not
Mm-hmm.
mistaken,
Mm-hmm.
because I graduated in 2007. So Tennessee State University won in 06. And it was just amazing. I
Yeah.
mean,
Yeah.
we met so many people from
Yeah.
all over the country.
Yeah.
We thought we was grown people.
Yeah. Right. Right. Out at a
So many
hotel and
poignant
hanging.
conversations.
Yeah. Yeah.
Oh
For
yeah, there
sure.
was
For
here's
sure.
another trip down memory lane, Katrice.
Mm-hmm.
We was in somebody's room. I think her name was Katrina Rogers.
Oh, I love
We was
her.
in
Yes.
somebody's room and we was having a serious debate. Like
That's right.
whatever
You would
we was talking about, we was
absolutely,
talking about it.
absolutely, absolutely. Katrina Rogers is amazing, a Spelmanite, and you're right because it's just all these smart kids and these all sorts of different kids and all sorts of different smart kids. But that's also the HBCU experience, like going to Spelman and being in the AUC. Like I had my own experience, being from Chicago and what I thought, life was and college was. And it's like, there's all sorts of Black people all in all sorts of places. And the Quiz Bowl was especially like, there's all sorts of smart Black people and we're interested in all sorts of things. And it was just amazing.
It really was,
Amazing.
and so
Yeah.
I'm grateful for the connection.
Yeah.
So that was about what 15 years ago.
Yes, 15. Yes. Can you believe it?
I feel old.
A whole
So
15 years
Katrice,
ago. Yes.
what have you
Yes.
been up to?
Yeah, so that was college, and immediately after I went to med school. I went to Loyola in Chicago, and then I did 3 years of residency, family medicine residency. And straight after that, I've been practicing family practice in Milwaukee, Wisconsin. So I just went straight through, and I've been practicing. But now, in the next month, I'm actually going to open my own practice after being 8 years employed, a DPC, a direct primary care practice. So I'm opening my own practice in less than a month now. Actually, yep, less than a month. So that's my
Congratulations.
life. Yeah, thank you. So, I did the
Congratulations.
steps, I was pre-med and kept doing the things, and here I am. Like you did the schooling and the steps, and here we are, you know. So
It's
that's a lot of
amazing
time.
how it's amazing how our life has taken us. You couldn't have told my 15, however old I was 15 years ago. I'm not that great in math. You couldn't have told me that I would be here. That this would be what I would be doing, ministry and engaging in conversations that help people to assist themselves in a global pandemic. I'm proud of your success. I'm excited for you opening your new practice, and I pray that you have ultimate success in everything that you do. So I don't want to belabor the moment. I want to hop right into our question.
Let's
And
get to it.
Here's our first question to the doctor, Dr. Katrice Brooks. As a medical professional, what are your thoughts about the way in which society has responded to COVID-19, and what has been your biggest area of struggle?
So, unfortunately, I would say I'm disappointed with society's response. I think we all wish that it would have been better, and that our response could have been better. But even to this day, it's disappointing to see that there's so much infighting in society rather than kind of focusing on the issue at hand and the problem at hand. So I wish that initially our response would have been more decisive and along the right pathways. And then once everybody got on board, even with common things like wearing masks and socially distancing, but once everybody got on board with that we could have done better to align and do better with that. And I think personally my struggle has been and we'll get to that later, but has been convincing those who are vaccine hesitant to get vaccinated, and also convincing people is real, like because of all the infighting, there's been a side of disinformation, which I don't know their benefit, like I don't know their end game, but it's been really hard fighting that. And so again, rather than focusing on the common enemy of corona, we're focusing on each other and fighting among each other. So I think we've done an abysmal job, and I hope it would have been better. This all disappoints me.
So one of the things that I've been concerned about, and it's strange because you would think that in this age that we're in, people would take information, especially information coming from professionals, seriously. But it seems like the pandemic has made everyone a doctor. Everybody is a scientist. Everybody knows better than the folks who's gone to school and who's labored to do what they do. So how do you feel? And have you? I know you can't like tell certain stuff because of Hippocratic oath,
right? HIPAA,
but
yeah.
Have you encountered someone
Yes.
in your office like, nah, doc, you don't know what you're talking about?
I have. So I won't even call it an argument, a discussion. So one, I always ask as a family doctor. So my job is to see all ages, all stages, womb to tomb. So as a family doctor, I always ask, is there something any questions that you have about corona or, anything? Do you have any specific questions? I see if they're not vaccinated, do you have any questions about the vaccine? I just always leave that open, especially during the pandemic. The amount of people who tell me no, they don't want to hear anything I have to say about it is shocking. It happens every day, many times a day. I won't say many, maybe it's 4 or 5 times a day where they want nothing to what I have to say. And it's like, hey, I am the scientific expert in your life, in your personal life, the person you defer to say, like, what do you think about this? You don't even want to hear my opinion. Like, that is strange. I still tell them because it's my job to convey information. So it's like, all right, well, you said no, but let you just know basic science so that at least you hear that in your ear. But I've also had arguments with people, but I don't even want to use that word argument, discussions, because I think one-on-one, when people talk to experts and people who know how vaccines and immunology works, you can defer to that and you understand and see that. But, people do believe, Google makes them a doctor, and they believe that watching a YouTube of their next door neighbor makes them an expert. And it is wild to me. Even when I see medical information, I'm like, who's the source? Like when I see these wacky articles, who wrote that? And, because we need some sort of accountability, right? We need some systems and other things. And I understand not trusting the system, but we have systems for a reason, right? When I'm sorry for even jump there, but when Trump got elected, people were like, oh, the systems are going to hold everything in place, right? Like, don't worry, we have these systems. So medically, we have like medical systems and trials and experts. Like we go through this professional certification process for a reason. So in times of trouble, we should defer to the experts because the alternative is to let people die, so that's that on that.
Listen, I completely understand. Let me also just say this. As a pastor, I want to say I really appreciate your dedication. I want to appreciate you being amongst the first responders, you being in the field, helping people to get well, helping people to get better. I have both my moms watching. My mom, Marilyn, is in the medical field. She is an in-home healthcare provider. My mom and my first lady, Francietta Nadine Allen, is the head nurse in OR at Grandview Medical Center in Dayton, Ohio. And I have my aunt who will celebrate her birthday on tomorrow, my Aunt Melinda.
Happy birthday, Melinda. Auntie Melinda. Mm-hmm.
Listen, I thank God for you ladies, and I thank God for the men. I have colleagues who are in this health field. One that is coming to my mind, Reverend Gillian Barber. She is in the health field. She's a nurse as well. I really appreciate what you all are doing. But I also offer prayer because it cannot be easy. I watched a Instagram video. DL Hughley shared an Instagram video of a nurse, and she just sobbed and cried. I don't want to go to work tomorrow. I don't even like my job anymore. Because she was like, I have 3 different human beings' blood on my scrubs right now. I had to watch 4 different people die today. One person grabbing my arm saying, please don't let me die. And you think about all of that, and you're like, okay, where is the misconnection that people are not taking this thing seriously? So I really appreciate you.
Thank you so much, and I agree. I don't want to get into conspiracy theories, but there are big powers at play providing disinformation. And I don't know what they are. I don't know why we have to fight so much disinformation instead of really focusing on the pandemic. And you're right, people are dying and healthcare workers are giving their lives and their health to this. So I thank them too, everybody. Like, it has been a year and a time, and for you to get up and keep going, because those unemployment checks are nice, right, for people, right? So for you to get up and keep going and keep putting yourself through this, and putting yourself on the front lines, right? Everybody, people in nursing homes, everybody that are going to work and can take care of other people, right? Thank you. People who are even supporting us taking care of people, right? Like the cleaning staff, because without them, this doesn't run, right? So you're not a first line worker, but you still coming in and you are frontline. We need you. Everybody who's continuing life, like showing up. This is everybody. We need to give ourselves grace. This is a time, and it is frustrating to fight this misinformation, and again, to fight among ourselves when really we should just be fighting the enemy and working together. Like, you would think that in times of strife and a pandemic, that we, instead of being frazzled, we would be together. But again, there are maybe parties that benefit from us being separate.
Absolutely. So let me ask you this, Katrice, you are a family lifestyle medicine doctor.
Yes.
What does that afford you to do?
Again, I take care of everything womb to tomb. So I'm going to explain what those are, especially lifestyle medicine. That's a difference. But as a family doctor, that's kind of like one of the older, I guess it's not even a specialty, it's a generalist, but we are the everything doctor. And so we have a residency training of 3 years, and we take care of all ages, all stages, womb to tomb. So some family doctors do deliveries, and that goes through pediatrics, adult medicine, and end of life hospice care. I don't personally deliver because of the malpractice, but I do enjoy prenatal care. So I like prenatal and postnatal care, just not the actual delivery. But that, I am an expert of many common things. So family practice, we can take care of 90 to 95% of things in the outpatient setting. So usually when you go to the ER and you have something going on, they say, go to your family doctor, go to your doctor, and they'll figure that out. And so that's what I do. I figure things out. So people come into me with vague things or very specific things, and I help them figure out what's going on. And sometimes, especially in corporate medicine, that means that I will then send them to a specialist for particular things, but I do have the training and the wherewithal to figure out how to take care of those things, which is what I'm doing. I'm creating my own clinic where I then will do kind of more of the family practice stuff. And so that means more of everything. Like, instead of the specialty care, I have more time to learn about those things and to give them the exact kind of recommendations that they should be doing. So I'll be doing that as well. But I do everything now. I'm the everything doctor, right? Everything. But also lifestyle medicine is an adjunct to that family medicine degree. And so a lifestyle medicine physician is one that has taken extra training after residency. So everybody who's in lifestyle medicine doctor has completed training after residency or during residency to learn how to treat the root causes of diseases rather than just giving the medicine for it. So I found that being in the clinic all these years, it was like, I feel like a pill pusher. Like, you got an ailment, I got a pill. And I didn't like that. And so I really wanted to get into like coaching people how to really change their lives so that they can get off of pills and have a better life, which we know is by treating the root cause of disease, we do much better for outcomes for stroke, heart attack, dementia. All of those improve by treating the root cause of disease, which is diet and lifestyle, diet and exercise, and getting enough sleep, and staying in an environment like a church, right? Taking Sabbath and other things that we know really help our life and make us better, healthier humans. So I got expert certification in that as well. So those are the two.
Awesome. So let me ask this question as we kind of shape this conversation regarding church and medicine partners in healing. In your opinion, how can churches and faith-based organizations partner with medical experts such as yourself and practices in order to create sustainable and valuable ministries?
I just think we need to collaborate. I don't know the best way to collaborate. Again, I'm about to go kind of private from a big corporation, but church and medicine, they've always kind of gone hand in hand, right? Like, I was born at St. Luke's Hospital. Like, all the hospital system or all the big hospitals used to be, church based, right? They came from the charity of church. And so we probably need to get back to that. And I think the pandemic has shown us, right? Like these large corporations and big things, we don't necessarily have to stick with them and go with them, and that an employer may not protect you in the way that you thought that it was going to. And so I think we should continue to collaborate on a local level. So I know personally my friend in North Carolina, Dr. Zoe Stalling, she's doing, COVID testing, partnering with churches. And, so on a local level, doctors can partner with churches, and medicine, we partner together. That happens now. Like my MA is, they're doing a COVID drive, and, we can continue to partner in that way. But on a bigger scale, we should also continue to partner, maybe more churches with, funding a hospital. The thing is, like, it is the Wild West. Things as we know them have not turned out to be what they are. So we can create and develop the tools that we need. If big organizations are not serving us, then we can create that, or we can influence them to change. We are change makers, and we have the capacity to make change in our lives. And that's on the small level, what we're doing day to day, like me talking to you, and we're spreading, awareness this way, or, even bigger levels or smaller levels too, right? Just discussion one-on-one.
Gotcha. So one of the things that I have kind of envisioned is that I would love to see doctors and churches, nurses, medical staff, let's just cover everybody, medical personnel and churches working together, providing some of the basic healthcare needs that exist within, the community. When I pastored in Youngstown, I was fortunate to have, I think there was at least 10 people at that church who were nurses. Maybe one or two still active. The rest of them were retired. And so we ended up partnering with the local hospital there, St. Elizabeth Hospital, which was a Catholic hospital in Youngstown. And there was a faith-based health facility program that we ran for the church. Third Sundays of every month was Health Sunday. We brought in health personnel to speak to the church. Maybe it was, Alzheimer's month. Maybe it was October Breast Cancer Awareness Month. Whatever the health awareness was, we brought in a professional to speak to the congregation. You could, at any time except during my sermon, go get your blood checked. You can get your, I need y'all to listen to me.
Right. You need the spiritual healing
Hear
too.
me, people.
Yeah,
Hear me, people. So, but you can get your blood pressure checked. If you needed some help with understanding some medication, there was someone there to help read it to you, explain when you're supposed to take it. You can get your blood sugar checked. All of the basic stuff that you needed done. And we emphasize basic. Nobody was diagnosing anything, and everything pointed back to St. Elizabeth Hospital. I would love to see churches develop that kind of ministry where you can bring in that person and have them to participate in your worship, because healing is, body health. Health is part of worship. You can't worship if you're in pain. I know some of the more provocative people will say, hey, worship through your pain. Oh, if I'm hurting, it's going to be a little hard for me to sing Amazing Grace with the choir if I'm hurting.
Absolutely. So,
I
think that's wonderful. That is absolutely, like, they are one and the same, mind and body. The mind is part of the body, right? And our spirit is part of our body, right? And they are all interconnected. And so we have the same goal of health and wellness and healing for our community, right? Because we are all in the community. So you're right. I would love, to be in a church and to also offer that, but that also churches have that too, right? That we have it within ourselves. Like when you go to churches, there are nurses and MAs and all sorts of people that work there and that are members, right? Like why can't we like help ourselves through that? That is novel, and it's where both places are, where we go to get knowledge and professionalism, right? Like the real. So
absolutely.
Yeah, I think that's wonderful.
100%. My mom, my first lady, friend Alan in Cincinnati, they have the First Ladies for Health, and they provide, they all work together with all of the churches in the area and the local community to address issues affecting African Americans. It's sponsored by, I believe, the mayor's wife of Cincinnati.
That's
She pulled
wonderful.
this together. And so they're always present at my home church in Cincinnati, doing work in the community. And that's the things that we kind of need. I know COVID has kind of separated us,
Yeah.
but how have you been able to do your work in this virtual space?
COVID has
Or has
changed.
that limited?
COVID has changed everything. In fact, COVID has shown us how easy it is for industries to change. Industries, the medical industry was one of them, but everything pivoted online. And so people have been working for years to get medical communities online and to have virtual visits. And even at my own place of employment, it was kind of something behind the scenes that they were kind of doing, but not really. But when COVID hit, virtual, right? Especially in the first 4 months after the pandemic hit in March 16th. After that, we did a lot of virtual visits, and then it became so much so a part of the practice that now when patients are running late, in my office at least, they've been allowed to just change it to virtual so that we actually have more people who can keep their visits because now this resource that wasn't available has become available. We've learned how we can manage a lot more virtually than we thought before. Especially people have found that they can get tools at home, like to take their own blood pressure and maybe a pulse ox. So if they're not feeling well, they can check that. So our patients have also learned during COVID kind of how to monitor themselves at home. And medicine-wise, we've again shifted online. I found that online doctoring is not that different than what I do in the room because a lot of it is the patient interview that we get, the diagnosis, but it is always nice to touch a person. And so that still has value, coming in for a lot of things still has value. And something else that I want to mention is that a lot of people have been deferring care because they didn't want to come in or they didn't want to be virtual. And that has harmed people. People have been deferring preventative health care because they were afraid to come in to get sick, or they just were, virtual medicine was so unusual and different, they didn't feel that was the same. And so they have been avoiding their routine medical care. So I've seen a lot of my patients getting sicker. I've seen a lot more anxiety and depression because of COVID and not seeing people, having to be virtual, having to stay in place. I've seen more other types of diseases that have to do with mental and resilience. So life has changed. Life has changed.
Katrice, we're gonna absolutely, and that's one of the things that I think all of us are going to have to get to. I have a question I want to ask you about how life has changed in just a second. We're going to take a quick commercial break, and we'll be right back.
All right.
Praise him with a violin.
Welcome. I'm Alphonse Allen, the senior pastor of Allen Temple AME Church.
And I'm personal injury attorney Blake Maislin, partnering together to bring you the Allen Temple broadcast.
Every Sunday morning at 11:30 on Star 64. We're reaching the city one soul at a time.
And now we're inviting you to join us.
Every Sunday morning at 11:30 on Star 64.
And we are back. So I have with me my good friend and college friend. I would say colleague, but we're not in the same. We're not the same kind of doctors. She's an MD. She can help you. I can pray for you, but she can pray and help. So if you get in trouble, go to her because she can pray and help you. Like if you stop breathing, she can ask the Lord to bring your breath back, and then she can also help you get your breath back. But I have my good friend, Dr. Katrice Brooks, with me. I'm delighted to have you on the show. I want to ask you this question and be as honest as you can. What does normal look like to you after COVID-19?
I don't know if we're going to have normal in the way that we expect normal to be. And so this is something that I probably should have mentioned earlier. I think we have done a disservice with not telling people up front what to expect and what it could look like. And so when it didn't look that way, people felt lied to, and as maybe they were deceived. So initially they told us it was just a 14-day stay in place. And here we are a year and a half later. So the truth is we don't know. And normal may not be normal or what we thought was normal for some years, right? It might be 5 or 10 years before we're going around without mask and not worried every time someone, especially someone unvaccinated, gets sick or just someone gets sick with COVID. And so I can't promise you or even guess what normal might look like because, we think that we're going to develop a cure and people will take it and then we'll get herd immunity and that'll be the end of it. But then something pops up and people are resistant to taking it and we didn't reach those numbers as fast as we wanted. And so now they're even saying that, herd immunity is not going to be enough and more people will need to get vaccinated. Otherwise, it might be a recurring thing. And so I wish that wasn't the answer, right? With COVID, I wish that it wasn't a new thing and that we knew everything about it. But it's not. And so we have to also, this is what Dr. Brennan does. We have to give to a higher power, and believe and trust and get through that. But in the meantime, and the normal for now, for the next year is, wearing your mask and socially distancing when you can. If you have to be indoors, absolutely wearing your mask. If you are indoors anywhere with anyone outside of your house, you need to have a mask on. If you can and are willing to get vaccinated, you should if you're over the age of 12. If you need the booster shot, meaning that you are immunocompromised, you have HIV, you are in active treatment for cancer, you are immunosuppression drugs because of autoimmune diseases, you should get the booster shot. I say that to say, this is our normal now, right? Here we are needing booster shots. I don't know if that's going to be the same thing in 6 months. It may be. This virus will transform and it will mutate, and the tools that we have will become ineffective. That is not us lying. That's how science works, or that's how life works, right? And so the normal is change. Change is the one thing that we can expect. And that is sad and it's depressing. Stay prayed up.
It really is.
It is. It is. I wish it wasn't. And you're going to get complications of COVID.
It's something. Go ahead. Keep going. I'm sorry.
No, it's okay. I didn't mean to disturb you. So if we continue to allow Corona to rage, so one, you take the risk of people who are not strong enough. I don't want to say strong enough, but who don't have the immune system to overcome Corona. They're going to pass, right? This Delta variant is more virulent and it is killing more people. More people are dying. It is more easily transmissible. So it's easier to give it to each other. Before the Alpha variant, we thought maybe you would transmit it to 3 people. Now it's at least 9 or 10. So it's getting more powerful. And the more we allow it to mutate, it's going to get worse. Mutations, some of them are not that virulent and they die off. Those don't even get that much ground, right? They don't become overwhelming. But when they do, they have a change that's close enough, but also bad enough, then it's going to get worse. And again, you get sick from the complications of Corona. I've seen that as well. I've seen people who were healthy 28-year-olds who were previously working, who have to take months off, right? Who I've had to fight law cases so people can get, disability that they're owed. And it's just, this is not just a flu that's not going to affect you. It is killing people. It is handicapping people. It is causing people a loss of income. And so to me, it's deferred to the experts. We don't know all the answers. That's why there's research. That's why there's science and there's trials and we're working to find the answers. But I'm going to trust somebody who's doing the research rather than my neighbor. And that's not to say that they are wrong just because they're my neighbor, but then, and I don't think degrees are everything, right? Like there is your own intuition, but there's also numbers. There are millions of people dying, right? Like the rate of Corona that we have is now the same as what it was in December before the vaccine came out. Like all the headway that we made, we have lost. And people are acting like Corona is gone, and it is not. Please, 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 guys, please, wear your mask, get vaccinated, stay away from people. I heard of somebody with Corona and people came over to visit them. What are you doing? Like, please listen, right? If the CDC says these things, and I know they have said, okay, if you're vaccinated and you're with somebody who's not vaccinated and there's this mask thing, and that made it really hard to know what to do. And so then everybody thought, well, I don't have to wear it. Some people aren't wearing it. I don't have to wear the mask. It doesn't matter. those things do matter, right? So if you're not in your small isolation pod, you should be trying to wear a mask, because the Delta variant is transmissible even among the vaccinated. So that means the vaccinated can still go home and give it to somebody else. And the idea is that it's in a much lower level. So I know this is what gets people up in arms. The idea is that you're going to transmit it less. It's still at high enough levels in the nose that it's the same as people who are unvaccinated, but they're not getting as sick. That's the truth. When they go to the hospital, 99% of people in the hospital are unvaccinated. This is still a disease of the unvaccinated. And I don't want to make it unvaccinated versus vaccinated, because it's also the mask and anti-mask. Like, let's do all the things. Let's give ourselves the best fighting chance we can against this virus. It's not, an us and them. I'm Black, right? Like, I'm from an HBCU. Like, the elite people are getting the vaccines. The president and vice president are getting, all the living presidents have gotten the vaccines. 96% of physicians have gotten the vaccine. And that's Black physicians too, right? So wear your mask, get vaccinated, do the things that the smart people in the room are telling us to do. That's it. I know.
Listen, I want to ask you this question. You're doing good. I'm really enjoying this.
I'm sorry. I'm so passionate. I'm sorry.
Listen, we need the passion. All jokes aside, we need the passion. Yeah. I want to ask you this question here. Catherine Whitfield asked, Dr. Brooks, you stated that people forego care in fear of getting sick at the doctor's office. Is that a legitimate concern, or how likely is it to get sick from visiting at the doctor's office?
Great question. I love questions, by the way. So if y'all want to do that, we can do that. I love them. That's a great question. Initially, in the beginning of the pandemic, people were very afraid to come to the doctor's office, and we didn't know. So doctors were also foregoing appointments. If we had a routine appointment and we could push it out, we were pushing it out for a while. And then it was like, oh, well, we have to get them in, or at least do a virtual visit. The concern about how transmissible the viruses are, or the virus is at the doctor's office, is not one that I don't think that science has yet found. They did do, like, when you're indoors and there's clear panels, how likely is it to spread? The good thing about a doctor's office is they usually all make you wear your mask. I don't know of very many doctors that allow you to forego your mask. So they make you wear your mask in the lobby and in the room while they're in there. But I don't want to promote fear and say anything to make people fearful. But when I leave the room, or before I come in the room as a physician, people might take their mask off and cough and do all sorts of things. So if you are indoors at any unfamiliar place, you should wear your mask. In my office, we are not doing any negative pressure air ventilation, and we know that this virus is airborne. Places are not as safe as people think they are. I'm not saying doctors' offices are not safe, and please do not take this and forego care. Please do a virtual visit. If you have a doctor, you are paying them to take care of you. Even when you don't see them, they're not getting paid when you don't see them, but they're on call for you to ask questions. Should I come in? What do you think my risks are? How do you think I should act? If you don't have a doctor, please find one. I think everybody should, have adequate health care. So there is a small chance of getting corona anytime you leave the house, right? Like, you're going to touch something and maybe forget and pull your mask down, and now maybe you got corona, right? We think it's usually there's contacts. It's like, oh yeah, we had that party and I knew that I shouldn't have taken my mask off, but I did. So usually people have an idea, but it is possible. It is possible to get corona in indoor places, and doctors' offices are probably safer than, your, I don't want to say a grocery store, because they're actually better ventilated than inside a small office, but they might be safer than a place. Say I went in the bank the other day and nobody had on a mask. They were in Wisconsin, where I am. People are corona complacent and they pretend like corona does not exist. So they do not wear masks indoors. I don't know why. The pandemic is raging, but people are indoors and talking to each other and not wearing masks. And so this is why corona is spreading like wildfire across the country. But your risk of getting it from your doctor's office is much less than those places. So if you are deferring care, please go in or call your doctor first and see if they can do a virtual visit. We now offer that every single day. Every patient has the option to make their visit virtual. So that's new since the corona.
So let's dig in here. I've been waiting to ask you this question.
Yeah.
I'm hoping to not ruffle your feathers. I'm hoping to ruffle some feathers of the people listening to your response. What is your advice to unvaccinated people whose stance of refusal is based on the miscarriage of justice towards African Americans wronged by medical experts?
Trust the experts. I know it is the experts, right? So on one hand is I want to facilitate understanding, right? Like the Black person in America has been wronged by America over and over again historically, right? Like the America has not been kind to Black people, and we have experimented on us, right? There's the Tuskegee experiment, and there's Henrietta Lacks, and there's all the OB procedures, and even to this day we see biases in medicine. Black women have a lower mortality rate than other women of any socioeconomic class. It's just there are poor outcomes for Black. So we are still not doing right by Black people. So I do understand the hesitancy and the distrust, right? This is our bed that we created and we need to lie in, and we need to understand why we are distrustful. But your sisters, your friends, your coworkers, your pastors, we are vaccinated, right? Like this is what they're saying is our chance of survival is that if everybody gets vaccinated, we can maybe have this thing go quiescent long enough that it doesn't have enough people to replicate it and it goes away. We're still hoping for that. That hope might go out of the window soon. It might be we are past the point of no return where this vaccine might not work. But right now we're hoping that it does work. We're hoping these measures still work. And so it's to trust the people fine. You don't trust the man, right? Or we don't trust medicine, and not just the man, or like we're being gaslit. This is a real thing. We are not treated well in medicine. Again, to this day, we think the perception of pain in Black people is different, right? Like to this day, there are doctors that have these things. So I would say go to somebody you trust. So find a provider that you trust, find a provider that looks like you, find a provider that you trust. And even if they don't look like you, that you just trust them, they have your best interest, and ask for their opinion, right? Find the people you do trust and ask for their opinion. And unfortunately, if it's your neighbor and that's what you're going to roll with, maybe I can't help them. I don't know. But us, right? Like I am in community. I have friends and family, and I know quite a few unvaccinated people. I don't know what to say to convince them to get the vaccine, right? They know me, but it's going to be within you to make that decision. But again, just defer to the people you trust. Right now, your life and the life of those you care about depend on it, right? Like I'm not going to get affected by Corona. I know that probably, but my aunties may, and my dad may, and other people may. So also think about community, think about each other, right? The reason why we're all getting vaccinated is so that we can save each other's lives. And the reason why we're doing all of this is so that we all survive this, not just like the fittest and the youngest, but that everybody survives. I've seen Corona save one of my patients who's 80 years old with diabetes life. Like otherwise, I know she would have gotten the disease and likely have succumbed. That's what I've seen up until now, up until the vaccine. And now, she has survived. And I have a lot of stories like that, a lot of very ill people who have survived, so defer to the people, that you trust.
Listen, my mama friend just said something. She really just kicked in. We have to understand there are Black experts now. This is not our grandparents' medicine. White folks got the shot in droves. Listen, one of the things that has concerned me, and I had this conversation with colleagues, pastors, who are just, trying to figure out what can we do in facilitating our part of helping the community in getting past this coronavirus. One of the things that we talked about in my network of colleagues and preachers is that, a lot of folks are bringing up the Tuskegee experiment. They're bringing up the fact that, still today, African-American women and pregnancy has a high death count of the mother dying due to complications in pregnancy because doctors don't believe when they say they are in pain. And it is not the same experience, but I have an experience of dealing with a doctor. I was sick, having some very uncomfortable pain, went to the emergency room, and it got to be a lot for me to go. I mean, I've probably, the number of times I've been sick, I probably could have prevented it had I took my butt to the doctor. I'm getting better with that. My aunt rushed me to the emergency room, Onslow County, and got in there, and the doctor came in the room looked at me and said, well, you're fat, you're overweight, and you're probably going to die.
Oh my gosh. Oh my gosh. That is terrible.
And that's exactly what he said. And, my aunt unleashed, a hell raising on this dude. And his whole attitude changed. His whole demeanor changed. He actually picked up the clipboard and started to ask me what was going on and tried to hold my hand. And I'm like, dude, I don't want to hold your hand. Don't even touch me. Like, I'm 5 seconds from jabbing you in your throat with your own ink pen. Yeah. Like, I already struggle coming in here.
Yeah.
And when I come in here, you pick on my weight, and then you say to me to my face, you're probably going to die. I mean, who wants to hear that? But one of the things that I'm learning is that preventive health care is important. I've lost several colleagues, in our age range to cancer.
Really?
A few of them in their 40s to cancer. Preventative health care is very, very important. But the things that I want to be sensitive to is that I do know that African-American women suffer from high mortality rate in pregnancy. That's a reality. That's a fact. You can Google that. That's Googleable.
Absolutely.
As I heard somebody say. Men suffer from bad health care because they all think that our blood pressure issues are related to what we eat. Many, I've learned that much of your blood pressure complications is due to environment stressors. But it's a pandemic.
Yeah.
The experts, the black doctors are taking the vaccine. The white doctors are taking the vaccine. My goodness, the Pope took the vaccine.
Absolutely.
Trump got sick and couldn't wait to get the vaccine.
Right.
The current president, my president, I have not been able to say my president in like 4 years. My president,
right?
Joseph Robinette Biden, he got the vaccine. I don't know what else you need to help you to understand the seriousness of one, wearing your mask. There's a K on that word, folks.
Yeah.
Mask.
Yeah.
There's a K. Mask. Everybody say mask.
Yeah.
I don't understand wearing your mask, getting the vaccination shot. If there's a booster, getting the booster. I'm just struggling with how all of these people are on social media and just causing the death rate to go up by spreading your conspiracy theories. I just don't get it.
Yeah, absolutely. They're hurting people. Actually, they are hurting people. It's not just, without any consequences. They are causing more death and more mortality rates and morbidities. Again, people get corona and they are not well after. There is more fatigue, shortness of breath. We see people who have to see all sorts of specialists. You incur money, time missed from work, time missed from your family, even the psychiatric components of it as well. So we're saying more anxiety and depression, just lots more harms because of this spreading and getting worse. People dying. And so now you have to deal with the grief of losing people from COVID. Like at this point, we all know somebody that's died from COVID. And so this disinformation is harmful. You are hurting people. And I know people are not doing it to deliberately hurt people. And maybe they're just misinformed. But again, the internet is wide. And if you stay in your own space, you're going to get the echo chambers. But look up, look at the experts, look at what your doctor is doing. If you've had a doctor your whole life, ask them, right? Ask the people that you trust. Like your commenter said, there are Black doctors now, right? Like we don't have to worry what, they're doing. We're here, right? Come to us and defer to us. There's Black pulmonologists and all sorts of experts. And then there are the people that we also know this virus is real. It is hurting people. And we all need to do our part. We need to wear our masks. We need to get vaccinated. And we need to socially distance if we can.
Absolutely. Katrice, we're going to take a quick commercial break, and then we're going to be back with our final question. But before we do that, I want to say thank you for taking time out of your busy schedule to be with me today. I really appreciate it. We'll be right back with a brief commercial from our sponsor.
Recently, God opened the door for J.P. Moore Mortuary and Cremation Services to expand into the Madison, Florida area. allowing us to provide stellar yet affordable services to families in need, families who are looking to honor the life of their loved one in the customs and traditions of our cultural experience. J.P. Moore Mortuary and Cremation Services offers compassionate and courteous service with unmatched satisfaction and a professional staff that can serve your family in a difficult time with dignity. The top 11 reasons why families call J.P. Moore Mortuary and Cremation Services are that we offer funeral services, cremation services. We have an on-premise chapel. We have J.P. Silk Creations, our on-premise florist. We offer grief counseling. We have 24-hour on-call service, at-home arrangements, out-of-town services. We have digital casket display. We offer air flight shipping, and we have reasonable and competitive pricing with a complimentary notary public. Spreading sunshine at the sunset of life. J.P. Moore Mortuary and Cremation Services. The mortician who cares more.
And so we're back with Dr. Katrice Brooks. I want to get some more information about this thing called COVID-19 from Dr. Katrice while we have her here. Let me just flag real quick. Mama Fran says, my prediction is that in the next 10 years, we will see some new lung issues and diseases that will be directly related to COVID. That's scary. That's like one of those wild moments, like, oh, man. And I can't help but think that is because of our slow reaction to getting the vaccination.
Yeah.
So, Dr. Brooks, let me ask you, monoclonal antibodies.
Excellent. So, yeah, I just wanted to talk. Perfect. So if you are in the risk category where your doctor has been begging you to get vaccinated, all your family and friends have been begging you to get vaccinated, but you didn't, and you did come up positive with corona, then you do have the option of the monoclonal antibodies. You definitely need to talk to your doctor and discuss it, but this can save your life. But that risk, like the side effects of monoclonal antibodies, are much more unknown than the side effects of this now FDA approved vaccine, right? So this monoclonal antibody has now emergency use, and it is saving lives. This is what the rich people get when they get COVID. This is what they go and get the Regeneron. That's no longer used for the Delta variant, but they go and get these. This is what Trump got, or similar. This is what they get to have their immune system protect them. This is available to everyone with risk factors, right? So if you have diabetes, you're overweight, you're over 65, you have coronary artery disease, asthma, COPD, other health risk factors that you should know that you have these. If you don't know, check the CDC to find out what they are. But if you have a risk factor, this can help save your life. But you have to push for it, and you have to get it within the first 5 days of your symptoms. So you will have to work with your healthcare provider or the health department.
Wow. Listen, Katrice, you've been a blessing to me and my viewers. I really appreciate you providing all of this expert information. Thank you so much for taking time out of your schedule to be with us today. I really appreciate it. I know my viewers appreciate it. This is the kind of conversation that I try to bring, conversations that are poignant, needed, relative to where we are within society, and that will help someone as they further along in the midst of this global pandemic. I ask everyone this question using the context of our conversation. How do you define unholy silence?
I would say that this is what we've been talking about the whole show. One, not speaking up and wearing a mask. I know sometimes it's hard indoors. Like unholy silence is doing harm by being silent, right? So when we are silent, when we know that there is a better way or an answer, that is unholy silence. When it comes with harms and death and morbidity, then that is unholy silence. So, I don't want to say not wearing a mask is unholy silence. I really don't want to take it there. But maybe promoting disinformation, propagating misinformation and disinformation, that's the opposite of silence. But, if you know that your loved ones should get vaccinated, but they're not really pushing them to do it. If you know that they are now radicalized and, can't get out of the matrix, really kind of encouraging them, not allowing disinformation in your presence. And, it not just promoting falsehoods. That's unholy silence. And yeah.
So before we go, I have one additional question. How readily available is the antibody treatment in rural areas? Is geographical location a factor in treatment?
So all places should be able to get it. I have colleagues in North Carolina that give it, right? And I know in South Carolina as well. And not just, you're right, in very rural areas, you may have to go wherever you got to go to the local hospital where you can get things from. But this is also at clinics. It doesn't have to be at a big center. In fact, for one of my patients, we were actually going to do it at our clinic. I was so unaware of it. And this is why I'm saying I knew that it existed, but I didn't know that it really could go through me. Unless you asked for it, you're probably not going to get it. If you go to urgent care, at one point they knew to tell people who are high risk they could get it, but people, you often will get sent home and say, oh, it's okay, just you are well enough, there's nothing, your vitals seem fine, you can go home and take care of it, and not do their due diligence to say, hey, there's this treatment, it might be a little work, but everybody is on the same page as to getting patients the treatment. In fact, the last time I had to give it, I had to come in on my off day to give them clearance to get it. And that was something that I felt I should do because I didn't want the patient to die. And so your own doctor plays a part in that, but you can even go around them and go to the health department, and it's being given at multiple places. In my own community, there were 3 different possibilities where they could get this treatment, and everybody was very gung-ho on getting it, but that's because they knew about it. Until then, nobody in my clinic had even given it, right? And this should be something that is available. So please get it if you can. And that's for now. This works for now. Again, Corona is rapidly changing. This might not be accurate information in a few months. Again, the old one that Trump got, we're not even using. That one's not even effective against the Delta variant. So.
I'm muted. I'm sorry. Katrice,
that's okay.
Thank you so much. It's been a long time since we've been able to be in the same setting. We're in a virtual setting. It was a pleasure meeting you, Ben. It's been a pleasure being your friend. I'm excited for your new practice. I pray God's blessings upon you, and that you being able to touch and heal as many people as you can, particularly through this pandemic. And I pray for your strength, your well-being, as you put yourself out there to bring folks the medical alertness and information and health and wellness that they need. Again, thank you so much. I really appreciate this. This has been a blessing. Thank you.
Thank you. I've had so much fun. Please bring me back anytime. This literally was a blast. I'm happy to talk about any and everything. As a family doctor, I have expertise in a lot of things, and I'm passionate to serve my people, and to give them real knowledge and, from a source that they can trust. I have aunts and mothers and dads, and, so.
Listen, you will be back. Don't even worry about it. I will have you back as we continue to try to figure this thing out in the midst of the global pandemic. You will be back. And maybe there's something we can do virtually. Maybe we can have a call in. We can use this platform to have some people to call in and talk to Dr. Brooks.
I would love that.
We'll figure that out, and we'll make it happen, because one of the things that I have said, and I continue to say and preach, is that I truly believe. I have another question that I need to ask you as well.
Okay, that's fine.
Okay, I was told to ask you this offline, so don't go nowhere when I end it.
Okay.
But one of the things that I continue to believe is that if for no other reason, God allowed us to experience this global pandemic to remind us of the importance of checking on your neighbor, or being aware of your neighbor. Because if you're not aware of your neighbor can infect you with COVID, and you can infect your neighbor with COVID. it's important for us to be aware of our neighbor. And looking out for your neighbor is what you're doing by putting on a mask. Looking
Exactly.
out for your neighbor is what you're doing by getting the vaccine. And so I really appreciate you taking time out of your schedule. I'm going to wrap us up, and don't go nowhere, okay? Stay
All right.
right where you are.
All right.
But
Thank you,
listen, folks,
everyone.
thank you. Listen, everybody, it's always a pleasure to be able to bring these conversations to you. I'm excited to be with you today, and I look forward to being with you next Sunday as we have another conversation. On next Sunday, I will have with me, I'm sorry, not next Sunday, but on the 26th, I will have with me Dr. Lamisha Whittington and Kristen Pearson as we talk about ecological theology and environmental justice. So you don't want to miss that conversation. We're going to be talking about ecological theology and environmental justice. We have to be concerned about the world because this is the world the Lord gave us, and He's requiring all of us to be good stewards of the world. So please tune in on the 26th, 3 p.m. As we have Dr. Lamisha Whittington and Kristen Pearson. As always, I try to provide a quote or thought for the day. Affliction brings out graces that cannot be seen in a time of health. It is the treading of the grapes that brings out the sweet juices of the vine. So it is affliction that draws forth submission, weanness from the world, and complete rest in God. Use affliction while you have them. Let us pray. Gracious God, I offer this prayer for those persons who are on the front line. I pray for persons who are providing the necessary help that we need to get through this global pandemic. I pray for nurses. I pray for doctors. I pray for hospital staff. I pray for my friend, Dr. Katrice Brooks, who's opening her new practice. And my prayer is not only that she has an influx of new customers, but she will also have the time, the skills, the staff, the patience to help every person who comes through her doors. Lord, we simply ask that you would continue to look upon this world, those persons who are suffering from the remembrance of 9/11. We pray, God, that you will continue to speak softly into their heart and their mind, reminding them of your presence. We thank you, God, for what you are doing in this world. Everything is not bad. Everything is not negative. There are some great and positive things happening, and I attribute that to the grace and the kindness of a loving God. But Lord, we specifically ask you to strengthen and energize every person who is on the front line working to get us through this global pandemic. This we pray in Jesus' name. Thank you for listening. Amen. Folks, it's always a pleasure being with you. I look forward to being with you on the 26th. And until then, stay safe, wear your mask, get vaccinated, share this broadcast. God bless.